Hello, everyone. Welcome to the third day of the Preemie Health Talks. I'm Fabiana Bacchini, Executive Director of the Canadian Premature Babies Foundation, and your host for this event. The Preemie Health Talks is the first of two international live series that CPBF is hosting 2020 in recognition of World Prematurity Day. Next month, we'll be hosting Preemie Power Week, and all the information is already available on our website. These educational sessions are in collaboration with the International Family Integrated Care Committee, the Association of Neonatal Nurses, EFCNI, and GLANS, the Global Alliance for Newborn Care. For those not familiar with CPBF, we are a charitable organization, and our mission is to support and educate Canadian families of premature babies every step of the way. We believe that through consistent information, access to helpful resources, and peer support inside and outside the NICU, we can empower families, ensuring they are ready to care for their baby. Consistent information is especially important today when we are facing a global pandemic. With the Preemie Health Talks and the Preemie Power Week, we intend to bring you the guidance of healthcare professionals and the knowledge gathered by researchers around the world, which are extremely valuable to help us care for families and their babies. I want to thank AbbVie for the unrestricted educational grant, Pampers, and all our amazing team who work really hard to create this event for us this week. And we already had one session today with Dr. Bosco Pais talk about the burden of RSV in healthy preterm babies, and his session will be available for those who missed today next week. And right here now, we have Marianne Bracht, as I mentioned before, talking about the survey that we did earlier this year, the parental knowledge of RSV, both in the NICU and after. CPBF Preterm Parent Survey was conducted to evaluate parental knowledge of RSV and other respiratory illnesses affecting premature babies. This data and parent recommendation to enhance their education and support will be shared with healthcare professionals. And right here, Marianne, who has 40 years of nursing experience in neonatology as a bedside nurse in the neonatal follow-up clinic, subsequently the NICU parent resource nurse, as well as the RSV nurse coordinator in the NICU at Mount Sinai Hospital in Toronto. Through her nursing career, she advocated for parents, provided education and support, created and co-led parent education programs, and participated in international research on family integrated care. Her experience has given insight into the struggles parents encounter in the NICU, as well as following discharge. Marianne has retired, but she's still very active in some research studies, and she is an active member of the Canadian Premature Babies Foundation, and she's leading a lot of our projects. Marianne, welcome. Thank you so much for joining us here today.
Fabiana, thank you. I am so happy to be a member of the Canadian Premature Baby Foundation. Let me see if I can get up my slides. There we go. Okay, hello everybody. Nice to be chatting to you. And I am going to actually refer back to Bosco Pace's presentation, because I think you'll get what I'm going to say as it regards to this survey. It'll show some of the points that he brought up. Anyway, looking back to move forward. And I have to say that is what we did. Ex-NICU parents and myself, when we became involved in creating this survey. As 40 years, I've been around a long time, but as 20 years as the RSV nurse coordinator at Mount Sinai, and parents who had an infant in the NICU, taken them home and had to struggle through the winter months fearful, collaborated on this survey. Our collective experiences created the questions that allowed the survey to get to the meat of the information needed to move forward to support families. I truly wanted to know what more education families needed, what more support. And the parents wanted to know what information support parents had received and what worked and what would have worked better. It's not a side note, on an important note, any project that any hospital committee, community, whatever wants to do, you've always got to include parents. Otherwise, their needs or what they need in this world, we won't sort of get that entire picture. So as Fabiana said, the survey was done and to build on current practices. It's applicable to everywhere. Pediatric wards. Bosco Pace talked about babies being admitted into the pediatric wards. Postpartum, all those babies, those full-term babies that he talked about. NICUs, clinics, and doctors' offices. So what comprises an RSV program? Well, in the 20 years that I was there, I learned a lot, and I have to tell you, I learned more following the survey. Essentially, parents need education, knowledge, and support all year. They need appropriate discharge planning, and staff need to be informed and knowledgeable both in the hospital and the community. And of course, when babies go home, there needs to be good liaison. So how does that happen? Well, I'm not going to spend a lot of time on this because Bosco spoke about this, but RSV is more than a common cold, and children less than 2 years of age will have at least one cold. It can cause severe lower respiratory tract infection, bronchitis, pneumonia, and he talked a lot about that. Talked about hospitalization, possibly long life complications, and in some cases death. Infants at risk, he talked about that. Less than 4 months of age, but he also talked a little bit about less than 6 months. Less than 36 weeks completed weeks of gestation, and bronchopulmonary dysplasia or chronic lung disease. Other groups are where the congenital heart disease and some specific medical diagnosis. There is more information on the Canadian Provincial Public Health websites as it relates to Canada, or the Canadian Premature Baby Foundation as it relates to Canada. So for those of you who may not have heard my presentation on Monday, I want to quickly just go over why these babies are such high risk. And it's to do with the lungs, the immature lungs. So here on the right-hand side, you see term, and everything is all in place. So we got the airways, we've got those little sacs called alveoli, and when this baby is born, is capable of taking a breath. On the other hand, the preterm lungs, and these are preterm lungs of infants less than 36 weeks gestation. So you can see that although they have more alveoli or air sacs than those of a 24 and a 25 weeker, you can see that they are pretty immature, and that is a concern. So now I'm going to talk about the maternal transfer of antibodies, and that is also an issue, especially in the preterm infant. The last 3 months of any pregnancy is when all the transfer of the maternal antibodies go through the placenta to the baby, or the baby to be born. This graph here, I have the bar, this tall bar circled, and this is the level or the amount of maternal antibodies that are transferred. If you go to the bar next door, that's the babies less than 36 weeks gestation to 32 weeks gestation. And it's less than 50% of what full-term babies get. Bosco Pace talked a lot about the 34, 35-week baby. We go to the bar here, and this is babies less than 32 weeks down to 28. And then here we have less than 28 weeks gestation. So you can see these babies are extremely high risk when it comes to things like respiratory infections, specifically RSV, as he talked about. So what does this mean as the antibodies, or these maternal antibodies, start to decline after birth? Well, again, at the bottom here, I have the months of age, and at the here circled off is, we have the green dotted line, the full-term babies, maternal antibody transfer. And now we get down here to the orange line and to the dotted line. These are babies less than 32 weeks gestation, less than 28 weeks gestation, and somewhere in between the green and the orange line are the 35-week gestational babies. So look what happens as they start to decline. Even that full-term baby, and he talked about full-term babies landing in hospital. He talked about babies under 4 to 6 months of age are at risk. Look what happens when these antibodies decline. Look how low they are for this preterm population. So you can see that preterm infants less than 36 weeks gestation are extremely high risk, but full-term babies can also get quite sick. So as Fabiana mentioned, the purpose of this study was to try and find out what parents really need to know to make it safer for their babies and to also make them have less anxiety. Canadian Premature Baby Foundation and Preemie Quebec wanted their programs to make sure they were relevant and accurate. And then we were going to share this information with healthcare providers so that they could actually add this information and adapt their programs accordingly. The national survey did identify gaps in the NICU's parents' full understanding of the impact of RSV. So I'm going to go over that now with you. There were a total of 691 parents that participated. Out of those, 583 were English speaking and 108 French speaking. That represented a cross-section of Canada. 647 infants had already been discharged. Majority were born in large urban centers between the years of 2015, 2020. This was a big take-home message for me. 77% or 85% French speaking parents had never heard of RSV prior to their infant's NICU admission. Yet, almost 50% had other children at home. Astounding. So what happened in hospital? What kind of information? What worked? So I highlight here the words received RSV information, and I highlight in depth. Most parents received RSV information. They received pamphlets, maybe a letter, maybe there was something on notice boards, but they did receive it. 30 to 80% did not receive in-depth education. And I will address that a bit later. 17% received no information. Interestingly, 80% of the English population and 67% of the French felt their knowledge to be good to very good. It didn't play out in reality. They understood the words bronchitis, pneumonia, but they didn't understand the complications. Only 13% understood that RSV, bronchiolitis, or pneumonia could be a major problem. So now the families go home. That higher percentage felt that their knowledge was good to very good when their babies were in the hospital, but that changed when they went home. Only 50% English and 65% felt confident or very confident. 70% continued to seek more information after discharge. So where the informational needs underestimated, most sought more than 3 resources to get more information. What more should we have available in the NICU, postpartum, pediatric floors, doctor's offices, and clinics? Hey nurses, any of you out there? You guys are superheroes. Parents overwhelmingly identified the nurse as the most valuable education and support and their first resource of information, followed by the doctors and printed materials. Parent education sessions also were fairly prominent, and I draw your attention to that because I do think parents learn a lot when they're in a group session, learning, sharing stories and experiences. I think it helps parents to learn better. Canadian websites were popular. Social media was regarded important as well. So here we go with the recommendations. And actually, some of these recommendations go back onto what Bosco said that they saw in some of the research that they did, different researchers. First of all, the most important thing is education regarding winter illnesses and RSV should be provided all year, not only in the winter. If a 35-week baby is born in September and it's still 80 degrees outside, we're not thinking about RSV, yet this baby's high risk. So it's extremely important. All parents should receive information regarding decreasing the risk of any infection when their babies are in the NICU. Full term, 38 weeks, 39 weeks, they all need it. Other modes of information should be provided, videos, websites, notice boards, any way that information can come across to families. That's what they wanted. They wanted the resources to be in multiple languages, easy to read, and that's extremely important. pictures with very, very limited words, because pictures tend to stand, you know, they see a picture rather than paragraphs and paragraphs of words. Information and education was wanted on vaccinations. Parents know their baby's lungs and their immune system is immature. They're fearful that if these babies get something like whooping cough, so they need this information to understand why it's so important to follow through with having all their vaccinations. They also wanted more information on flu shots, not only just for themselves, but also for family members and friends. Now, this is where I actually go to when it comes to RSV prophylaxis and what Bosco Pace had to say. What parents identified was that babies who qualify for these protective injections, the parents should know why, understand, and how. And there was a disconnect between in the hospital, maybe in the information they received there, and then ongoingly when they went home. But it's not only about the injections, it's also about decreasing the risk of infection. Those two things go hand in hand. It's important to follow those hygiene protocols. Now, to those babies who don't qualify, those parents need to understand why they don't qualify. But they need the information to understand how to decrease the risk. The problem lies with the fact that you have a parent who has a 32-weeker maybe, or a 24-weeker, that baby qualifies. And you have a parent who has a 34-weeker, they're both in the NICU. Both parents are equally as anxious and equally as worried about their babies. The mom with the 24-weeker says, my baby's getting protective injections. And the mother of the 34-weeker says, what? So what happens? She becomes super anxious. And then they start trying to find the doctors. They speak to the bedside nurse doesn't know, and you can see how this story goes on. So what were the recommendations that parents had to support staff? They felt there should be more education spread around the NICU. There should be notice boards, there should be pamphlets, there should be all kinds of things that are available for families to understand how important it is to protect their babies, also in the NICU as well, because Bosco Pace talks a lot about babies at risk, the very preterm babies at risk, right from 0 right up to 6-7 months of age. And those are still in the hospital, some of them. They also wanted the healthcare professionals to receive more resources, to know where parents should go for information, know what was available for parents out there. They also felt more signage in the NICU, posters, so family, friends, grandparents could see this information as well. Because many grandparents and many friends would say to the families, you know, why worry? Because it's really important for a baby to be exposed to infection, and then they'll build up their immune system. So it's extremely important that these people are all well informed. What was a big gap was the missing information between the hospitals and the community. So if a baby was not to be getting RSV prophylaxis injections, but the mother thought they did, they would go around searching to find out how they would get it. Or they were told the baby did qualify, but they didn't know how to get it. And so they also felt that when the health nurse came to visit, the health nurse didn't really know anything about it. When they went to the pediatrician's office or the family doctor's office, they didn't really know about it because it hadn't been as well communicated. And this seemed to be a lot of stress for families. So here's the game changer. We all know about it. And it's all about 3 core practices: education, education, education. Education in the NICU. The burden of disease. I think if everyone saw Bosco Pace's presentation, we would be washing our hands more than anything else. Infection prevention measures, we know. And then in services with public health nurses, with communities, with doctors' offices, anything to get that information out there. Even in the doctor's offices, parents were saying that RSV information was not there. So I believe that's maybe one of the reasons why parents of full-term babies, of siblings now that were 3, 4, and 5 years of age, didn't know anything about it because there was no information available in their doctor's offices. Year-round parent education, that is a huge take-home message. So what do we have to think about when we think about providing information to parents, and some of the things that parents actually identified? There's a fine line between too much or too little. If there's too much, there's anxiety. If there's too little, there's anxiety. It has to align with the infant's medical diagnosis and the family's social circumstances. So let's say we have a 35-weeker, does not qualify for prophylaxis, but has a sibling in daycare in the home. So what kind of information does that family need? On the other hand, if it's a 24-weeker and they have no siblings, or if it's a 28-weeker that's born in June, this has to pertain to the circumstance. Literacy is an issue and English is the second language. But I also in brackets have the word health there, because I think if we use too many medical terms, it goes right over the parents' heads. So it really has to be clear and concise. Bosco talked a lot about fear and anxiety, even when babies were readmitted because of RSV. This fear and anxiety is happening as babies are leaving the NICU with their parents. They're fearful their babies are going to go back into hospital. So it's important that we provide the education, the information, and make all the appropriate referrals to clinics, public health nurse, community nurses, whoever it is that's going to be supporting parents when these babies go home, and providing parent with the educational tools so that they can educate their family and friends. Parents talked a lot about targeted education in the survey. And some of the ways I believe that we can do this is through counseling, in that we provide complete information. It needs to be transparent and it needs to be concise. Avoid information overload. That was one of their comments. Recognizing teachable moments. It's not about stopping a parent in the hallway and giving them information on winter illnesses or RSV and saying, read this and I'll catch up with you another day. We need to take time. We need to sit down. And I suggest having both parents or significant others when we're talking about this, because people absorb things differently and interpret things differently. So we need to clarify, we need to repeat, we need to follow up. We need to include easy to read written information. We need interpreters when the parents don't speak English or limited English, and preferably not using family members. Family members interpret what they hear or what they want their family or their children or their daughters or whomever to hear. And we need to provide contact people and phone numbers, because that was missing that the parents brought up in the survey. Liaising with the community, family doctors, clinics, public health, and any children's aid or support agencies is extremely important, and they asked for that. So they talked about, it's all about keeping our baby healthy. It's all about what we need to be able to do that. And we also are concerned about our mental health because it is a challenge. So we need to provide the information and support on communicating with family and friends. Why, what, and how. And we don't want grandparents to say, you got to take this baby outside to be exposed. Otherwise, this baby is not going to build up the immune system, as I mentioned. We need to provide a toolbox of information at transfer and discharge. So I have here on the side 2 little booklets that in Canada are extremely useful. The one here, purple, is put out by the Canadian Premature Baby Foundation, and it's also available on Preemie Quebec website. It talks in depth about RSV, bronchitis, pneumonia, immunizations, vaccinations. And this booklet up here above it with this funny little man is on the RSV Shield website, and it's called RSV, not just a common cold, something like that. And it has very basic information. And I think these 2 booklets would be really valuable to put into the toolbox. The discharge summary, how to decrease the risk of infection, who to contact, why your babies are having these injections, why they're not, whatever it is. They need information on peer support. They talked a lot about the challenges. They felt as if they had been let go into the community and they really had no support. They wanted peer support. They wanted information on mental health. So it's really about us getting out there and educating the community, the public health, and any agency that are involved with family, including, I believe, doctors' offices and clinics. So I looked back a lot, as did some of the parents who worked with me, and the parents in the survey talked about how we could move forward. Provide targeted information and support. It's a major need, both in hospital and following discharge. Provide information on educational tools and materials that Canadian Premature Baby Foundation and Preemie Quebec have, and they have a lot. They have videos, they have podcasts, and they have written materials that are downloadable. Ensure healthcare professionals have a better understanding of RSV prophylaxis guidelines, both in hospital and the community. Here's a take-home message. When parents have the information and resources and access to next steps, their reliance on social media and ex-NICU parents may decrease, including anxiety. We do not want that mother of a 34-weeker panicking because she was talking to another mother whose baby got the protective injections, and now nobody knows how she can be supported through that, why the baby should or should not. This is extremely important. So I go full circle. I started this with saying what I considered to be a really good, solid RSV program. And I learned a lot with the survey. And I wished I'd had that survey when I was actually an RSV nurse coordinator. But here is the take-home message. Ensuring families all year are well informed. That's every family in the NICU. It doesn't matter if it's a 39-weeker that goes into the NICU. Those parents are equally as panicked. And these babies could be at risk too. Appropriate discharge planning, RSV prophylaxis for those who qualify, and information for those who do not. To support this, we must have informed, knowledgeable NICU and community staff. This goes to postpartum floor as well, because there are a lot of all the full-term babies are there. Midwives, if babies are being born at home. This information needs to be available and freely out there for parents to be able to access and to share with others. Written information that does not stand alone. We cannot hand information to families and get them to read it. It needs to go with education and good community liaison between all the healthcare professionals in the hospital. So the bedside nurses need to have the information, doctors, the residents, and all the community healthcare professionals as well. So here are some of the resources that are available to families. Canadian Premature Baby Foundation and Preemie Quebec do have that winter illness booklet. And then what I have here, just above here, is an infographic. And instead of the bars that I showed you in terms of the antibody transfer, this shows you a pregnant mom, weeks gestation, and the transfer of the antibodies. And then on the other side of that infographic, it actually shows you the immature lungs and then the full-term lungs. This is downloadable, and these are the things that the parents need to know. It's not just about the injections, it's about how to decrease the risk. Families need to know that they need to follow the hygiene protocols, and COVID-19, I think, has actually helped society to understand this a little more, but it's regarding decreasing the risk. RSVP does not protect your baby from an RSV cold or decrease the risk. RSVP is trying to keep the highest risk infants out of hospital, but every single newborn, every child baby under the age of 6 months, under the age of a year, needs that consideration. And on the other side, we have the RSV Shield, and this booklet, RSV More Than a Cold, fantastic booklet with easy to read information to be shared. So please have a look at all these tools that are available in Canada. And I'm sure for those of you that are calling in from other countries, you have these tools as well. So a summary of this report is on the Canadian Premature Baby website, and there is a link to the actual full report if you would like to know more. So now if anybody has any questions, please feel free to give them over to Fabiana.
Thank you, Marianne. That was a lovely presentation, and I really want to thank you for all the work that you did for the survey and to create the report. I also want to thank Dr. Bosco for helping us to write this report and put all the information available for healthcare professionals and families. I also want to thank the families who participate in the survey. As Marianne said, we have over 580 families participating on the English side of Canada. And I also want to thank Preemie Quebec for collaborating with us in this project. It's such an important information. And we have a comment here from a healthcare professional, I believe, who said, I worked in postpartum for years before going to work in the NICU. And I never knew of RSV until I worked in the NICU. So more education is needed for staff, not just in the NICU, as rightly said by Marianne. So a confirmation of what we were just saying. So thank you for that comment, and thank you, Marianne. So we have a couple of questions here. First of all, why parents never hear about RSV before the NICU? Even myself, I had a term baby before my preterm baby. He was 3 years old. He went to daycare. I had never heard of RSV until I landed in the NICU and I attended your educational session, and I had the RSV booklet that we just shared. So why is that? Why is that gap, Marianne?
Well, you know what? I think it's an absolute failure of the healthcare system, because RSV is the most common RSV cold virus. If any of you listen to me on Monday, you will see that that's the most common cold virus here in Canada, and I suspect it is throughout the world. Bosco talked about that earlier before me. It's an absolute failure, because I think doctors' offices have to have this information. They should have those booklets. They should have posters on the on the wall. I believe that public health nurses should all be in-serviced, and they should have these booklets. Midwives, postpartum, absolutely. Whoever sent in that comment, 100%. And I know that that was the case, because I did the RSV risk assessments at Mount Sinai Hospital for a number of years. You know, Bosco talked about those infants less than 36 weeks that we had to do a risk assessment on. And the postpartum nurses didn't know anything about it. And I think the thing is that nurses have to know so much. So how do we give enough information to nurses that allows them to draw the attention to families, so they can see things on notice boards or be given information that allows a little bit of education? I believe a toolbox needs to be handed in postpartum as well. I think there should be a toolbox given by midwives. The toolbox doesn't have to be a great big thing with wrenches and everything in it, but it could be a folder of some information and some education before babies go home. And of course, I'm going to go to the pediatric clinics and family doctors. They need it too, big time.
Absolutely, Marianne.
They talk they talk a lot about flu. You go to any doctor's office and they'll talk about flu, and flu injections. So yeah, sorry. They can add RSV to that same notice board.
Absolutely. Never too much information, I believe. As a parent, we always want to know to, be better parents and parent better our children. Marianne, how does cities or state decide RSV season? Because there's some winter season, there is no official declaration of RSV.
How do some cities and some states
decide on RSV season?
In Canada, it's based on the Public Health Agency, because what happens is when babies go in, or when babies or children go into hospital, swabs are taken. When people are sick, they have x-rays done. I mean, there's a whole bunch of different things that get done to determine when an RSV season starts. And actually, that was an important question, because in Canada, RSV injections start at different times of the year, because in some provinces, RSV doesn't start till December. Whereas in Ontario, we start in October. So I suggest you go to your public health agency websites to find out about the RSV season and have a look to see what goes on. For us in Canada, everybody can look up the Public Health Agency of Canada, and they document weekly, and you can see the increase of all the different viruses, rhinovirus, adenovirus, all the viruses are there.
Thank you, Marianne. Now, you mentioned that parents, or one of the recommendations, parents are educated all year round in the NICU. But we know there is a gap in education. How can we change that?
Toolkit. Well, I think if everybody heard Bosco Pace talk and everybody heard what the burden of disease was, and the slide that he gave about those babies who had had some kind of respiratory infection, how their lung capacity was when they were 30 or 35 years of age, I think if we understood what the burden was, and we have to understand what the burden is. And I think it has to be absolutely in front of all nurses. This is such a long conversation. There needs to be in-servicing, because parents do not know what to ask. Parents do not go into the NICU and say, I've heard about RSV, can you please tell me about it? And yet that is one of the most dangerous viruses that can put their baby into hospital and possible death.
Absolutely. But one thing that I remember from my NICU days, there were pamphlets about RSV in all the aisles at Mount Sinai on the NICU floor. There was also a bulletin board with the flyers.
Correct.
All year round. And we were admitted in May, we were discharged in October. So we went through the summer. So I remember always reading and seeing the booklet, the RSV, until the day I came to your education session and you actually taught us what RSV was and the risks. So I do believe that we need to, make it clear, because sometimes parents are so overwhelmed in the NICU and we don't grasp the information right away. But when you see over and over again, visually, or something is handed out to you and you have actually a session, I think that is so very important. But I also don't want to put all the burden of education on the nurses, because this is the reason why CPBF did the survey, to really understand the parents' knowledge, but how we can also support your work as a healthcare professional to educate families. And we've developed a lot of materials. We have podcasts, we have webinars. This video will be available and continue to be available on our website after the Preemie Health Talks. We have the booklet, the RSV Shield website link is also on our website. So there's a lot of information that you can direct your families to our website, and it's all evidence-based. All our materials are created in collaboration with clinicians.
Right. So I think the first line is if the baby's in NICU or postpartum, okay? And if that doesn't happen in June and July, fair enough. But if they have a visiting nurse going into the home, or they go into the family doctor or to the pediatrician, if they have information, you see, the thing is that, or they don't necessarily have information, but they get drawn to the websites, the Canadian Premature Babies Foundation website, or Prema Quebec. You see, I think that, there's all different levels of where information can be imparted to families. And so I think if everybody has a general idea, families can get this information throughout the year. It should be as common information as flu injections.
Absolutely. And I asked Dr. Pies about the importance of families keeping the schedule of going to RSV injection appointments. Good. Even during COVID-19, and I'm asking the same question to reinforce the message for the healthcare professionals to ensure the parents that it's safe to go to their doctor's office to get the prophylaxis injection. Absolutely. Because of the aftermath of RSV is devastating for families.
Well, yes, and if you're actually talking about the immature lung as well, it's even more devastating. I agree, because this RSV prophylaxis is an antibody, and it only protects the baby for a small period of time. So we don't want parents to think they've got one injection and then they think that baby's safe for the next 5-6 weeks. No, that baby's not. And so they need to follow the schedule to ensure complete protection. But they can't get the injection either and go to the mall. So it's about decreasing the risk. On the other hand, two things I want to say. Mental health is a big issue for families taking a baby home from the hospital. So it's important for families to go out walking, but they need to be safe about it. The other thing is, we're talking about decreasing the risk. If your baby gets RSV, that's not your fault. That happens, especially if you have children in daycare or in kindergarten. It's about knowing how to decrease the risk, following those guidelines, and then if your baby's extremely high risk and they want them to have injections following that schedule.
Absolutely. That's a very important message. Marianne, what was your takeaway from this work that we did this year with the survey?
My takeaway in terms of what I learned, because the RSV program at Mount Sinai was okay, pretty good. But what I didn't understand was the incredible anxiety and worry and stress that families had trying to make sure that their babies were protected. Yes, they've washed their hands, but they didn't understand why. They didn't know about the immature lungs. They didn't know about the immature immune system. Yes, they knew that their babies were immature, but they couldn't apply it. And sometimes they worried unnecessarily. And sometimes they worry too much. So I really, really, really think we have to, for the NICU, it really has to start in the NICU in a way, because those parents are already anxious. We really need to support them to have the right anxiety in the right place. For the full-term babies who we never see, they need the general information to ensure that their babies don't get sick. Bosco talked this morning or earlier about the cost of families having babies in the hospital. It's not money is one thing, but parent anxiety, loss of job, loss of money. And so we need to start at the beginning. I always feel that when there's something not so good happens in this world, doesn't matter what that is, you have to go back 20 steps to find out where that could have started and how we can work from there. So it's about baby steps moving forward. And the Canadian Premature Baby Foundation and Preemie Quebec, you guys are in a good position to get the information to the hospitals, maybe even the postpartum floors. And maybe that's something, because I'm not busy, Fabiana, you and I can do together.
Thank you, Marianne. And for all of you watching us, the survey, even the summary of the survey is available on our website, with all the recommendations and the tools that are available for the units to share with their families. Marianne, thank you again for joining us here today, for sharing your knowledge, your expertise, and all the work that you did for us this year. So thank you.
Well, it's my pleasure, and I'm really excited. If it makes everything good for babies and their families, let's do it.
Absolutely. Thank you. And thank you all of you for
Bye.
joining us today. Thank you. And thank you all of you for joining us today. We have people from a lot of different countries, and I'm very grateful to all of you who are able to join us here. And I want to thank again AbbVie and Pampers for the ongoing support to this project of the Preemie Health Talks. And CPBF is a registered charity, and 100% of all donations received this week will go to our educational programs for families. To donate, please go to CanadianPremies.org. It takes only 3 minutes of your time, but will make a huge impact on the lives of the families that we serve. And